Healthcare in America is undergoing enormous change. We at Intermountain have chosen to be an active participant in that change. There is inconsistency in quality and outcomes. Costs are increasing at an unsustainably high rate. Intermountain Healthcare is building a bridge between the way healthcare has been provided, largely reactive, and the way it will be provided in the future, more proactive and engaging. Shared accountability is our approach to help deliver the best health for our communities and the best care for our patients at costs that are affordable and sustainable.
It really involves the payers and the providers and the patients. And as such, the three groups have shared accountability to try and make sure that we have appropriate, high-quality care for all of our patients, and that then we start to move upstream into work on areas of prevention so that we can help prevent the major problems that patients have. And that has two really good outcomes. First outcome is better health for the patients and the population. The second outcome is cost less for us to manage the health in that area. So that's the whole idea of shared accountability.
But to the extent that we can keep people healthy, out of the hospital, in fact, out of the emergency room and out of doctors' offices unless appropriate, that is really the intent.
We use three key strategies to help us reach these goals: using evidence-based medicine, engaging patients in their health and care choices, and aligning financial incentives for everyone with a stake in healthcare.
High quality amazingly results in lower costs in healthcare. So as we've worked through our clinical programs over the last 15 to 20 years with quality improvements and been able to measure the improvement in quality outcomes and look at how the costs compare, invariably the costs go down as we do that.
What will change may be the way that we look at patients across the continuum, and instead of working in silos, we may need to start thinking about where does this patient go next, and how can I make sure that that transition is as smooth as possible so that they don't end up back in the hospital for a complication that was unnecessary. And how can I help their family understand how to get involved in caring for the patient when they get home?
Engaged patients are more involved in their own health and care choices, and they interact meaningfully with caregivers.
Patient engagement is a process where patients are actively invested in their own health. They better understand the expectations. They communicate clearly with their providers and caregivers, and they consume health care responsibly. And we have to be diligent in creating an environment where patients can be successful in achieving their health-related goals.
So we will provide the tools so that patients and health plan members can maximize their health. We will support them in terms of information on living well. We will have our clinics provide services that are needed. And we will also then have as backup the hospitals to provide care where that's needed.
What this means is we are now taking charge of and accountable to the entire continuum of care of patients. And if we can go upstream and treat these people effectively, we can significantly reduce the burden of disease.
Intermountain is aligning financial incentives to encourage hospitals, physicians, and patients to maintain health as much as possible and to support providing the best care whenever needed.
The Select Health leadership team is deeply involved and working across the system on the Shared Accountability Initiative. It's very important to move away from the current fragmented fee-for-service payment system to a payment system that is based on value, but also incorporates payment based on service, access, quality, and total cost of care.
So Intermountain's strategy as we move forward to work with everyone that participates in the healthcare system. So as part of our shared accountability strategy, we're working with the clinicians that treat our patients at the bedside. We're working with payers, we're working with employers, we're working with physicians, and we're working with the patients themselves to make sure that we all are focused on doing the right thing, which is providing the greatest value for our community and for our patients.
Our mission is helping people live the healthiest lives possible. Together we have the opportunity, indeed the responsibility, to create a better healthcare system and give the gift of better health to those we serve.